welcome to our Back to School webinar. I'm Jamie Callie with RWJBarnabas Health Medical Group. Today I'm joined by Dr. Lipstein, Dr. Musunuru, and Dr. Salim. Welcome. So wonderful to have you here. We're going to talk some healthy habits, talk about some things to maybe discuss with your child's physician, and get you and your child ready to start the school year off strong. If you're joining us live and you have any questions, please feel free to type them in the chat, and we will have time at the end for Q&A if anyone has any questions. But we're going to get started. First, welcome everyone to our webinar. Thank you so much for joining us today. I'm going to start us off hopefully with an easy one. I think they'll all be easy, but in terms of getting your child ready for back to school, I think one of the things that comes to mind for a lot of parents or guardians is school physicals and sports physicals. I'm guessing these are very routine exams and visits that you all have with your patients, but if you could just maybe talk about or walk us through a little bit what a parent or guardian could expect or should expect from their child's school or sports physical, and anything you might want to share to sort of keep in mind or prepare so they're best prepared for that visit. So, and it's open to the floor. Anyone can dive in and get us started. So, Dr. Lipstein, you look like you want to say something. Go ahead.
Absolutely. So I think when you are bringing your child in for their physical, whether it's in the immediate term before they go back to school or really at any point during the school year, some of the basic grounds that we're going to cover is the growth of your child. So of course we check the height and the weight of your child and compare that to where they've been over the last year or so, and previous years when they've come in for their checkups. We will review your child's habits, for lack of a better word. So eating, sleeping, bowel movements, just all of those things that sort of contribute to making your child healthy, and to see where they are on, on that spectrum, and see if there's any questions or concerns you have related to those habits and how we can address them. Generally, we go over the development of your child. Are they doing age-appropriate behaviors? And that varies significantly based on the age of the child, but I would also include in that school performance and any concerns that you have or that the teachers had from school, either going into this coming school year, from the previous year, or that have come up over the course of the last year while they were in school. And then we sort of go into the physical exam part of it. If you are there specifically for a sports physical, there's also a set of questions or discussion about how things go for you when you're participating in sports. Are you having any symptoms associated with activity or any concerns about your sports, keeping up with the other kids your age, things like that. We'll do a full physical exam, and then kind of on the back end, see if there's anything else that you do for any immunizations. Do you need to have lab work done? Are there any particular other things that are unique to you, any, medications, things like that, that you would need to go through. And I guess one thing I would throw in at the end, which probably should have come at the beginning, is before you come to your physical, please think about what questions you have for your physician, because some things only come up in the middle of the night, or they only come up, in March, but you're coming in for your physical in July or in August. And if you have specific issues or things that you want to address and you want to talk about with your pediatrician, this is the time to bring those things up and see if we can help to address them, at your physical.
Excellent. Dr. Musner or Dr. Salim, do you have anything you'd like to add?
The other thing I emphasize outside of everything that Dr. Lipstein says is a lot of preventative care. So my teenagers, we talk about safe sex, even though they may or may not be sexually active. I do ask them if they want the parents to leave the room in case they do want to discuss something that's a little bit more sensitive. And then vaccines are another big thing that I do touch on as preventative care. And especially for parents that have questions or are hesitant and want to go off cycle, and how the vaccines are recommended, because they don't want to do too many shots at once or anything like that. We definitely spend a decent amount of time touching on why the vaccines are important and which ones to get at which time.
Excellent. Oh, Dr. Musunuru, I can't hear you.
Sorry.
That's
Just to
okay.
kind of add to what Dr. Lipstein and Dr. Salim mentioned, I think it's an additional safe space for children to come address their concerns as well, like bullying and things like that in school. It just, gives them contact with another adult that they could address their problems with, because sometimes I think a lot of kids have, for whatever reasons, like
Mhm.
they might be having things going on at home or they don't feel safe at home. So I think it's just it gives them that safe space to address any problems at home or at school.
Excellent. And you guys are so great, leading me right into my next question. We touched a little bit about immunizations and vaccines. I know Dr. Salim spoke to, the schedule that there is, and, at times maybe not wanting to bombard a child with too many shots, but how do you help a parent or a child even? I was terrified of my immunizations probably till I was a teenager. What do you say when there's hesitancy around those immunizations? And how do you sort of walk a parent or child through that so they're more comfortable with them? Once again, anyone is free to open up.
So I usually start by emphasizing to the parents and to the child, depending on how old they are, it's their body. I'm just the GPS system in a sense. So they're in control. If they don't want to do it or they want to do it a little differently, that's just a conversation that we have to come to a mutual compromise. And as long as eventually they get all their shots, it's not the end of the world if they're a little off cycle, as long as they're vigilant about symptoms and they know the risks and the benefits and everything. A lot of my parents more so have hesitancy on the like 4 shots all at once and how the child gonna feel and what happens and all of that. And I think more just having an open conversation and talking to them about side effects and fevers, chills, what to do so that they feel prepared. Most parents are open to actually following the recommended schedule. Oh, and the other thing I have my MAs do is we do 2 shots at once. So it's technically 2 pokes, but it's at the same time. So 2 MAs go together. So it makes the parents feel a little bit better that it's just at the same time. So it's technically feels like 1 poke. And that sometimes helps as well.
I would have so appreciated that as a child. And I appreciate what you're saying there, Dr. Salim. And I think everyone's touched on this a little bit. This idea of like you're in conversation with both parent and guardian and child should be in conversation with their pediatrician, family medicine doctor. Right. It's not just sort of like a checklist that you just sort of like punch all the holes through. Dr. Musanero, Dr. Lipstein, is there anything you'd like to add? Anything else you sort of might touch upon when there's hesitancy in relation to immunizations, vaccines?
I think the biggest challenge with immunizations is when parents don't want them at all. And I think that that is like I mean, I don't like to force them in that first visit, but I like to have a continued conversation. Um, it's almost a double-edged sword when you tell people to do their research because you want to make sure they're doing their research on the right platforms. So when I say do your research, I like to provide them the platforms that they should be researching on rather than doing a simple Google search, because that's a whole vast void of space that can come up with a lot of false information. And so that's the open conversation I like to have with parents. I'm like, here's some, literature that you should read. And at the end of the day, it's your decision, but I'm just here to give you the recommendations and just guide you in the right direction.
Excellent. Dr. Lipstein, anything to add? If not, we can move on. No worries.
Not specifically. I have to agree completely with just the idea of an open dialogue and communication. You have to hear where your families are coming from, what are their concerns about the vaccines, and that can range on a wide level about what exactly it is that they're concerned about. And some families have very specific concerns and some have more general concerns, and just keep going with an ongoing conversation about it. Because I'm starting from the recommended schedule that the CDC and the AP recommend doesn't necessarily mean that's where we have to end up, but we have to have a dialogue about it, and they have to understand that it's going to come up at every visit, and we're going to revisit what vaccines are recommended and also why they're recommended and at what ages and what are the illnesses that we're trying to prevent their children from acquiring, when they're out about in the world, because the bottom line is that we're just trying to do our best to protect their children, and the parents are doing their best to protect their children also. We really should be on the same page. And that's where we're trying to go, and work to get to that point.
Excellent. And like you said, the sort of the theme right now is like this open conversation. I think what Dr. Musunuru touched on as well is, the education that also comes out of some of these visits is just as important as everything else, the paperwork you might fill out, and things like that. And the relationship building that happens, whether it be a school or sports physical or like a general well care visit. With the fact that back to school is happening very soon, I know that backpack safety is a concern for a lot of parents. And obviously you need a functional way to transport books and notebooks and things like that to and from school. But when it comes to, like the size and the weight of the backpack, what is some guidance you give parents and guardians in terms of how to, keep students not overburdened with weight and make sure that they're wearing the appropriate backpack in the appropriate way?
So
you can get
I
started.
think the rough guidelines is, number one, it should fit on your back. So
Yes.
it should be hanging down or over or sideways. And that's an issue that you sometimes see with the younger children. It should not weigh more than, let's say, somewhere between 10 and 20% of your body weight. So that's a problem on the other end of the spectrum. So you have high school students who are lugging around 30 to 40 pound backpacks, and that's just too much for them to be carrying on a regular basis. Some schools allow you to have rolling backpacks, which is one way to address that issue, but not all schools do. And so that can be a little bit tricky. And I would say the biggest thing is to wear your backpack on both of your shoulders and make sure that those wide straps that are giving you the support are over both, and you're not on one or the other, because that can throw off your balance and really create some musculoskeletal problems when you're carrying around a heavy backpack on one side versus both.
Excellent. I know the single shoulder is guilty of it myself when I was younger, but my more adult self really wishes I'd worn my backpack on both shoulders. Dr. Salim, Dr. Musunuru, is there anything you'd like to add real quick to any of that sort of guidance or suggestions?
No, I think the general rule of thumb I like to tell parents is it should go from like the shoulder line to basically their waistline in terms of length. Plus 2 inches is like the cutoff, I think. And then it shouldn't be any wider than their shoulder width. So basically the length of their back and the width of their back. Like Dr. Lipstein said, the weight should be around the 10 to 20% of their body weight.
Yeah, I usually explain it to my kiddos as if you have to hunch over to be comfortable. It's either too heavy or it's too big, and we got to make some changes.
That's a very easy rule of thumb to follow. Very sort of like go with your body. If it's sort of cumbersome, then you're overdoing it. Excellent. And because we are mentioning ways that it is very easy to incorrectly wear a backpack or overburden what's in your backpack, what do you say to parents? Like, when is like the back pain or discomfort something where like you want to have them bring a child in to sort of get a little checkup, make sure that they're not doing, like Dr. Lipstein mentioned, that musculoskeletal damage? Is it like mild or chronic, or is there a cutoff, or is it just if you're noticing that they're wearing it incorrectly for a certain amount of time, maybe good to get a checkup? Do you have a rule of thumb for that?
I wouldn't say rule of thumb necessarily. For me, at least, I usually tell parents if they've complained more than twice of, hey, mom, my back hurts or my shoulders hurt, or you just notice that they're struggling through the day, or they come home and there's like a sigh of relief when they take their backpack off. It's usually worth at least getting it checked out versus like, because the kid may not say anything. They may think this is normal. Everybody does it. It's usually worth just a quick visit or at least a telehealth, get it checked out, get it addressed, because the earlier we catch scoliosis or any musculoskeletal damage, the easier it is to backtrack and repair.
Excellent. Dr. Lipstein, Dr. Musunuru, anything you want to add to that, or?
No, I mean, I think Dr. Salim covered it. Yeah, usually it's just more so kids addressing it with their parents, but I would say if they complain about it more than 2 times, they definitely need to be evaluated by a physician.
Excellent. And still in this back to school sort of breath, when it comes to sort of healthy hygiene, healthy health tips, is there any sort of tips or tricks you recommend in terms of like keeping your child at close to peak health all throughout the school year? You know, there's a lot more germs. It's a lot more inside time. You know, you're coming out of summer where a lot of people are spending, you know, gathering, sure, but in an outside location. And usually with people they know, you know, now you're in school and it's a lot of different people in an indoor environment for a long period of time. Is there any recommendations or health tips you have for parents for sort of like longevity of health to get them through to the end of the school year?
Yeah, I think obviously in these past 2 years, hand washing has become a really big staple in every household. I think that's something that we definitely stress at our well child visits. I have a little bit more of a difficult time with screen time for kids, just because now, especially for older kids, so much of their schoolwork involves looking at screens or, you know, researching online and things like that. General rule of thumb I like to do is weekdays, 1 to 2 hours of screen time outside of schoolwork. And then weekends, you know, it could be like 2 hours. But more so, I like to also make sure that they're going out to play and it's not all video games and just, you know, TV all the time, that they're keeping active. And then the routine, you know, dentist appointments, the routine eye checkups, like making sure they're hitting the dentist twice a year, and an eye appointment at least once a year. Those are the general things that I like to cover in my well child visits.
Excellent. Dr. Lipstein, Dr. Salim, is there anything else you'd add to Dr. Musanuru's list, we'll call it?
I usually, I guess, preemptively have the conversation with parents. Their kids, they're gonna get sick. They're not gonna wear their
Yes.
mask the right way. Like, just be mentally prepared that it's gonna
Mhm.
happen. Keep Tylenol on hand, keep vitamins on hand,
Mhm.
lots of fluids and hydration. The more hydrated you are on a regular basis, the easier it's gonna be to stay hydrated, especially if you get sick. And then just when to call the pediatrician or the physician, when to seek medical help, trouble breathing, if they have running a fever and it's not coming down off of Tylenol, any
Mhm.
kind of ear pain, anything like that, definitely worth getting checked out and just making sure. I mean, they're kids, they're gonna get sick. There's no way you can keep a healthy child through the school year. It just doesn't happen. So just making sure that they're aware of that and they know what they have a plan in place of when
Mhm.
they can call me, where they can reach out, what the on-call numbers are, and how they shouldn't hesitate because the longer we prolong an illness, the worse it's going to get.
Mhm.
Just making sure that they're ready for that and then keeping up with their nutrition. With my teenagers, I emphasize stress and anxiety. Like, so many of my teenagers are chronically anxious and
Mhm.
overburdened and they just think it's the norm of, well, everybody's like this. And touching in the well child, not everybody is anxious all the time. We need to backtrack and see what's causing the anxiety. And that's
Mhm.
where I like to do, if the parents are okay with it, just a one-on-one with the teenager. This is a safe space. Mom and dad don't need to know what's the issue, what's the problem,
Mhm.
what's causing the anxiety, to address it before it becomes a chronic adult anxiety issue.
Mhm. Excellent. And I like the sort of also managing expectations you kind of have there with, you know, the understanding that it is very normal for children to get sick throughout the
Right.
school year. Just, you know, being prepared for that both mentally and having, you know, whatever it is your supply may be, like you said, some Tylenol, some vitamins, you know, maybe making sure there's a little extra vitamin C in the diet or something
Mhm.
during those really in the winter months when everybody sort of seems to have a cough or the sniffles. I think that's important too, because I think there's tends to be a little bit of pressure trying to keep your child healthy. Of course, everyone wants healthy children, but it's unrealistic to think that they'll never get sick. And a cold from time to time is not going to hurt the immune
Right.
system. Dr. Lifteen, is there anything you'd like to add?
So I think I would just piggyback a little bit on the baseline healthy habits.
Mhm.
For sure, you want to make sure that you have that good variety of nutrition. Eating a diet with fruits and vegetables is going to give your immune system a lot more support than adding like a lot of extra supplements into your diet. And the other thing is sleep, especially the teenagers that we see are so chronically sleep deprived. They think that normal, like Dr. Salim said, just like the anxiety they think is normal, they also think it's normal to get 5 or 6 hours of sleep by the time they hit high school. And most of us don't function well at that level. And so you'll feel better, and also your immune system will function better if you're really getting an appropriate amount of sleep for your age, which for a teenager hopefully is 8 to 10 hours. For younger kids, it's going to increase. And that will also, just sort of set your baseline a little bit higher as you go into the school year, and hopefully set it up so that when you do have that exposure to whatever viruses or illnesses are going around, as we said, it's inevitable. You don't get as sick, or it doesn't throw you for as much of a loop as it would have, if you're not sort of optimizing all of your baseline habits.
Excellent. The last question I want to touch upon, and I think Dr. Musanur and Dr. Salimi both touched upon this in other questions. What should parents or guardians be looking out for in terms of bullying at school? Because I think Dr. Salim, you had mentioned, or maybe it was Dr. Musanur, I'm sorry if I get it wrong, but they don't always kids don't always come home and just sort of say, okay, here's my started school at this time, and here's a rundown of every little interaction I had and whatnot. So what are some signs that parents and guardians can be on the lookout that something like that might be going on, or just general too much stress and anxiety? I think there's always like a little bit of stress around school, but where it's a point where it might be a concern that you want to bring in the healthcare provider and start having like a little bit of a broader discussion about that. Anyone can open it up.
So I usually start with like talking to the parents as well. If there's like a fall in grades all of a sudden, if they're all of a sudden making excuses about why they don't want to attend a class or they don't want to go to school, if they all of a sudden become withdrawn from the parents, or there's just a shift in their regular behavior. Sometimes it's just a teenager being a teenager, or a kid just being a kid, and sometimes it's worth talking to the teachers, see if there's anything wrong, or talking to the kids and having that open dialogue to say, hey, if somebody's bothering you, like nobody should be getting a laugh at your expense. Or if somebody says something to hurt your feelings, you need to let mom, dad, teacher, doctor, somebody know that this is an issue, that, hey, so-and-so said something and I didn't say anything to them, but it did hurt my feelings. It's okay to have your feelings hurt, but it's also not okay for that person to keep doing it over and over again. And that's where an adult needs to step in and help them in that sense.
Excellent. Dr. Musanur or Dr. Lipstein, is there anything you'd add to that?
I think Dr. Salim mostly covered. I think sometimes it's just so subtle what the kids can show to parents. And it's not always easy to come into a doctor once a year and pour all your feelings out. So I think it definitely is, the parent is the easier adult to go talk to. So we definitely encourage parents to have that conversation. At least, once in a while, make sure everything's going well at school, make sure they're feeling safe at school, things like that. But I mean, it is worth us like exploring it during our visits too, because sometimes some kids, they do want that outsider opinion. So I always like to do it in my well visits, but I definitely encourage parents to do it, because more likely than not, kids are more comfortable with their parents talking about these topics.
Excellent. I think the theme, other than back to school for this discussion, is really open dialogue and conversation on all fronts. Parent guardian to child, parent guardian to physician, child to physician. Conversation is key. I think that's a really nice takeaway, because I think sometimes, especially for kids, going to the doctors can be a little scary. But I think as we sort of frame it more and more just in our talk here, is like, this is a conversation. It's a time for you to talk to somebody about, like you all mentioned, any health concerns you might have, any questions you might have. I think it makes the visit a little bit more relaxed and pleasant for the child, certainly, but I think it's also a little empowering too to know that you have a voice at your doctor's office. And so if there is anyone joining us live and they have any questions, you can please add them to the chat. If not, is there any final thoughts anyone would like to give? If not, I mean, I think we covered a wide breadth of topics. Just check the chat. I don't see any questions, so thank you all for joining me today. If you are live and you missed any part of this, this will be on our YouTube and our Facebook page sometime during the week, and you are free to rewatch our back to school webinar. Other than that, thank you all so much. Please enjoy the rest of your afternoon.
Thank you, you as well.
Thank you.
Thank you very much.
You're welcome. Bye-bye.
Bye.